Lack of skilled and available health workers is a major challenge for Uganda's health sector, especially in remote parts of the country. To ensure that health workers are available and address human resource shortages and skill gaps, the USAID Strengthening Decentralization for Sustainability SDS program recruits skilled health workers under the PEPFAR-funded Human Resources for Health HRH initiative. Through this initiative, SDS recruited 1,212 health workers in 71 districts in both public and private not-for-profit health facilities. In Kaliro district alone, SDS recruited 14 health workers including nurses, midwives and laboratory workers.
Just before SDS came in, the government of Uganda had carried out mass recruitment of health workers for the health center 4s and health center 3s, and so there was a gap at the health center 2s. So when SDS came in, they helped us to improve the staffing at the health center 2s. And you know the health center 2s are the ones where most of the community is.
The waiting time has been reduced, especially in outpatients. They used to come here and wait for a long time because we were understaffed at that time. At least these 3 people who came in covered those gaps.
SDS partners with district local governments and Acclaim Africa Limited, faith-based organizations, the Uganda Catholic Medical Bureau, the Uganda Muslim Medical Bureau, and the Uganda Protestant Medical Bureau to improve human resources for health. Sister Mary Goreti Namboze heads Budini Health Center 3 in eastern Uganda. She is one of the 3 health workers that SDS recruited here. Since 2013, when the program began supporting the facility, health services, especially for children and pregnant women, have steadily improved. With funding from PEPFAR, the USAID SDS program recruits health workers, pays salaries and allowances for selected health facilities. The program also conducts routine staff in-service trainings, provides technical supervision and recognizes outstanding performance to further motivate the health workers.
I'm so grateful with the SDS. It has been doing its work very well. They kept on mentoring us. They had to know whether every month we've received our salaries. And another thing, they made the increment on our salaries. We are so grateful. Yes. Then I had a comment that though the contract is almost ending, they would have postponed it for the year at least, and it ends the other year.
And to ensure that these gains are sustained beyond the life of the SDS program, SDS works with district governments to include these health workers onto the national payroll. Of the 671 SDS recruited health workers seconded to the public sector, 46% were successfully transitioned onto the national payroll.
We have different phases in terms of how our programs go, and I think the next phase of working with the Ugandans at the decentralized level is going to be a more systems approach rather than a service delivery approach, so that we can actually make these systems work without our support over some period of time. And as a partner, Cardno has been incredibly responsive to USAID and all of our multiple needs as the program has expanded. And I think because it was such a successful program, we tried to take full advantage of it and expand its scope and its areas of operation throughout the country.
As the SDS program winds up activities, transitioning the remaining health workers onto the national payroll must be a priority for the government of Uganda.